30 an hour. Her respiratory rate might drop to less than 12. She may have changes in her mental status or level of consciousness, and she could develop a cardiac dysrhythmia. So some protocols will ask to put the woman on telemetry. The antidote for magnesium sulfate, calcium gluconate, should be readily available. And again, the risk for magnesium sulfate toxicity is the possibility of respiratory depression. Multiples, and that ends gestational hypertension. So multiple pregnancies, twins, triplets, quads, and beyond, that's considered a high-risk pregnancy as well. Our assessment is always going to be for preterm labor because that's the greatest risk. And is the mother able to carry, how close to term, to 37 weeks can we get this mom? So our assessment is going to be, is she monitoring herself for contractions? And the management of multiples may include restricting some of her activities in the third trimester. So at times, it's possible that women who are carrying multiples, the treatment might be that she leaves work earlier than, let's say, her singleton counterpart. They also sometimes will consider giving mom betamethasone prophylactically in case she does deliver her babies early. Polyhydramnios and oligohydramnios, this is too much or too little amniotic fluid. And when we see that in our client, for polyhydramnios, the biggest clinical manifestation you'll see is that she'll have increased bundle height measurements and she'll have quite a girth. And for oligo, she may have decreased bundle height. Typically when we see this, one of the places that we can look is on ultrasound is to check for the kidneys to see that they appear to be normal and they're not enlarged. It also could indicate that there's a problem with the placenta or membranes, so we want to check fetal well-being. And it also could be the size of the fetus, so if the baby is macrosomic or IUGR. Typically, if they have polyhydramnios, there's not a lot we can do. We're going to just watch her and monitor her, being mindful that if we rupture her, it's quite a gush of fluid, and there is a slightly increased risk of prolapsed cord. For oligohydramnios, we're going to monitor her continuously as well, often, not continuously, often. And in rare circumstances, they could do an amnio infusion with sterile saline to try and boost the presence of fluids in the abdomen. And then finally, other complications. These are at the tail end of your chapter, and that's isoimmunization, which has to do with Rh incompatibility. And we talked a little bit about this, if you remember, back in normal pregnancy, and that was with our negative moms. So if they had a blood type that was negative, or if they're O, positive or negative, we have to check and see what the baby's blood type is, because we know that it is possible that if the woman was not covered by her injection of RhoGAM in the last pregnancy, that she herself could have antibodies that are circulating, and now she's distributed to the baby, and now that baby would actually undergo fetal coagulation and basically have issues when the baby's born. So it's a hemolytic disease of the newborn. So they're breaking down rapidly their blood cells. It can place the baby at risk, certainly, after the baby's born. So that can be considered a complication if we know that there's been isoimmunization in uterus and that there's that risk to the fetus, fetal demise. And then obviously a fetal death is a complication in pregnancy. It's a negative outcome and one that is quite unfortunate for women who carry it to the third trimester and then they suddenly lose their fetus, their baby. So, and your textbook speaks to the importance of psychological support, understanding that this woman will have to move through the labor process to deliver her baby who had a fetal death, and then counseling and guiding her and her partner after the birth of her baby to discuss any post-mortem, whether they want an autopsy, cause of death, that kind of a thing. So that pretty much covers the complications from chapter 21. So Donna Bishop will be covering Chapter 22, which is those special considerations like age and cognitive and factors that can impact pregnancy. But you have now received Chapter 20. Those are conditions prior. Chapter 21, conditions that arise. And certainly reach out if you have any questions. And have a great spring break, guys. Take care.